Two of the most common women's health conditions in the world, millions of women affected, decades of research underfunding, and a healthcare system that has spent years telling women their pain is normal. Today, we are talking about PCOS and endometriosis, and we are not holding back. Let's start with the basics because a shocking number of women are never properly told what these conditions actually are. PCOS, polycystic ovary syndrome, is a hormonal disorder affecting the ovaries. It disrupts ovulation and spikes androgen levels. It causes symptoms including irregular periods, hormonal acne, excess hair growth, and hormonal weight gain, and extends to insulin resistance, infertility, chronic fatigue, and mood disorders including depression and anxiety. PCOS affects 6 to 13% of women globally, making it one of the most common hormonal disorders in existence. Endometriosis is a chronic inflammatory condition where tissue similar to the uterine lining grows outside the uterus, growing on the ovaries, fallopian tubes, bladder, and bowel. It causes chronic pelvic pain and painful periods. It also leads to painful sex, bowel symptoms, and infertility. About 190 million women worldwide have endometriosis. That's more women than have diabetes, yet it receives a fraction of the research funding and clinical attention. Here is where it gets infuriating. The time from symptom onset to PCOS diagnosis ranges from 2 months to 13 years. Primary barriers include the dismissal of symptoms by providers and a failure to perform basic diagnostic tests. Up to 70% of women with PCOS remain undiagnosed. Women see 3 or more doctors on average before getting answers. And only 35% of women report satisfaction with their PCOS diagnosis experience. For endometriosis, it's even worse. The average diagnosis delay is 4 to 11 years. In 2026, ACOG published its first ever clinical guidance to try to reduce that gap. This first ever clinical guidance on endometriosis diagnosis is a critical step, but we are still far from where we need to be. Black and Hispanic women may wait twice as long as the average for a proper diagnosis. Twice as long. For a condition that is already taking nearly a decade to identify, this disparity is unacceptable. Why are the delays this long? Because period pain got normalized. Because chronic pain was called stress or anxiety. Women were told it was just part of being a woman. Research from the University of Colorado found voices were not heard. This lack of hearing led directly to delays in both diagnosis and effective treatment. And then there's the funding. NIH funding for endometriosis was $28 million in 2024. HIV/AIDS received $3.1 billion. This is despite endometriosis affecting more than 5 times as many Americans. That is not a medical oversight. That is a policy failure. When women do get diagnosed, what does treatment actually look like? For PCOS, treatment commonly includes weight loss recommendations and prescriptions for oral contraceptives and metformin. But referrals to nutritional or mental health support are nearly non-existent. It's treated like a prescription checklist. For endometriosis, hormonal therapy and surgery remain the primary tools. New oral options are expanding. But treatment decisions should be made by a multidisciplinary team based on an individual's unique goals. Personalized, comprehensive care is the standard. Most women are not receiving it. Here is the part that matters most. PCOS and endometriosis are full body conditions. The symptoms span your entire life. From your skin to your mental health, symptoms fluctuate daily and change across your entire hormonal cycle. When you finally get into that appointment after waiting months, you have 15 minutes to describe years of symptoms. You are trying to describe years of complex data from memory. That is how women get dismissed. Not always because the doctor doesn't care, but because the data was never captured. You walked in with a feeling instead of a pattern. FoXX Health was built for exactly this moment. We are a symptom tracking platform that helps you log full body symptoms daily across your cycle and hormonal health. We help you track everything from pain levels to sleep and energy, so your data is organized and ready. So when you sit down with your specialist, you walk in with months of organized evidence-based data. Not a feeling, not a memory, a pattern they cannot dismiss. PCOS and endometriosis are not rare. They are not in your head. They are not just a bad period. They are chronic health conditions. They have been underfunded and undertreated for decades. You deserve better, and it starts with your own data. Be sure to subscribe to hear more women's health news powered by FoXX Health.